Audience members, stakeholders, Minnesotans, thanks for showing up today and for what is hopefully an enlightening and intellectually stimulating hearing. It's Wednesday, February 12th. The quorum is present, and the Minnesota Senate Education Policy Committee will come to order. Today we've dubbed it Mental Health in Schools Day. We have several testifiers. I would encourage any members in the audience that have an anecdote to share. I think today would be a nice day to hear. Earlier today in Ed Finance, we heard about school lunch programs, and it was nice hearing in that it wasn't filled with, not that data is not important, but we heard a lot more from anecdotes about what parents and kids and how teachers and even school nurses have benefited by universal school meals. And so it was just a delightful day to hear anecdotal evidence to complement the data that we often hear. Mental health is a crucial aspect of student well-being and academic success. It is often overlooked in schools. Poor mental health can lead to increased absenteeism. A huge issue before us this year is absenteeism. Lower academic performance and other school conflict, making it harder for students to reach their full potential. One of the things I got out of college was Maslow's hierarchy of needs, and I just loved learning about that when I was a young man, and it became an instrumental part in the rest of my teaching career. And as Maslow said, if we can't get off those first few stages of our needs, we're never going to get to level of self-actualization. And I think ed policy's number one goal is to get every child as high up on that scale towards self-actualization as we can. And so issues such as anxiety, depression, and trauma can create barriers to learning and helping them get to that level of self-actualization. This is especially true for students in our marginalized communities who often face additional stressors like discrimination, economic hardship, and social exclusion. Providing intentional mental health supports in schools ensures that all students, regardless of background, have the opportunity to thrive in a safe and supportive learning environment. First, we will hear from Minnesota School Social Workers Association. Then we're going to hear from the Minnesota School Counselor of the Year. We've heard this year so far from the Superintendent of the Year, the Teacher of the Year, and today I look forward to hearing some thoughts on why the Counselor of the Year was bestowed with that honor. Then we're going to hear from Out Front and Gender Justice and Multilingual Learning, and there's where we are at. So that's today's hearing. Thank you for showing up today. And with that said, Julie Campanelli and Abby Refsland, you're up. And identify yourself for the record and sign in. There should be a sign-up sheet up there.
Okay. I don't know. I think these are going to work. Do you have that? I don't have that either. Can you use your laptop?
We'll send help up. You need help with the technology?
Yeah, none of these,
The adapters
don't work.
Okay. Well,
Sorry.
Do you have a USB-C?
I have a Thunder.
Okay. We can borrow Jenny's.
Yeah, that should work. As long as it's got either USB or machine, which it looks like it's got machine.
Looks like it's got both.
You saw the presentation.
I did. Want me to share it again? I can share it again.
This might get you there. That might also work. Let's see if that
Thank
works.
you.
Excellent, thank you.
Thank you.
okay, that's what our species is all about. That was a gracious and elegant gesture on your part. Does our heart good when we see members of our species helping out each other. So thank you for that gesture. And members, the PowerPoint's in your packet.
Hold on here. Oh, wait. Why did it do that? Oh, God. Okay, Abby, I'm going to have a
Just
problem.
read on mine.
I'm going to have to read on yours. So Julie Campanelli from the Minnesota School Social Workers Association.
I'm Abby Refslin from the Minnesota School Social Workers Association.
All right, so good afternoon, Chair Swadinsky and esteemed members of the Education Policy Committee. My name is Julie Campanelli, and I come before you not just as the president of the Minnesota School Social Workers Association, but also as someone who has spent the last 28 years working directly with students and families who are struggling.
Chair and Senators, my name is Abby Refslin. Thank you for allowing me to speak with you on behalf of the Minnesota School Social Work Association. I am currently a licensed independent clinical social worker, a licensed school social worker, and a member of the Minnesota School Social Workers Association Board of Directors. I serve as a school social worker and as the director of Agate Social Works, which is an organization that provides school social work services to schools that otherwise would not have them available.
Thank you for the opportunity to speak today on behalf of school social workers across the state of Minnesota. Today, we want to talk about a crisis that is affecting our students, our schools, and our communities. The growing mental health challenges facing our children. This is not a Democratic issue. This is not a Republican issue. This is a Minnesota issue. It is a human issue. And if we do not come together to address it now, we will be facing consequences that extend far beyond the walls of our schools. Minnesota students are struggling in ways that we've never seen before. The most recent Minnesota student survey revealed that nearly 1 in 3 students report experiencing long-term mental health problems. Among 11th grade female students, the numbers are even worse. 45% report struggling with mental health, a staggering increase from 35% in 2019 and just 27% in 2016. For our LGBTQA students, the crisis is even more severe, with 63% reporting significant mental health struggles. Suicide rates among our LGBTQ plus youth remain alarmingly high, and many of these students lack access to safe spaces where they can receive support. But the mental health crisis in our school is not just limited to one group of students. We are seeing it everywhere. Students as young as elementary school are showing symptoms of anxiety and depression. I have seen elementary students having panic attacks, refusing to enter the school building, and experiencing outbursts because they lack the emotional regulation skills to process their distress. Middle schoolers are engaging in self-harm at alarming rates, cutting themselves in school bathrooms, hiding their pain, and feeling hopeless about their futures. High school students are struggling to see a path forward, reporting feelings of worthlessness and, in too far many cases, experiencing suicidal ideation. Just to give you context, in my school district alone, over the last 2 weeks, we have conducted almost 20 suicide risk assessments, and the majority of these assessments were conducted in elementary buildings. One of the most visible signs of this crisis is the increase in behavioral issues, violence, and school aggression. Teachers and school staff are reporting more incidents of physical fighting between students. some leading to serious injury. Case in point, we all saw on TV a brutal assault against a high school basketball player during a basketball game. We are also seeing outbursts of aggression towards teachers and staff, students destroying property in frustration, and severe disruptions in classrooms that make it difficult for teachers to teach and for students to learn. We are having classrooms that are being evacuated for extended periods of time because it's unsafe to be in the classroom right now. And this is happening all over Minnesota. And while it's easy to label these students as troublemakers, I want to be clear. These are not bad kids. These are kids in crisis. These are children who have experienced trauma, who are struggling with anxiety and depression, and who do not have the tools to manage their emotions. When students feel hopeless, when they are living in survival mode, they do not have the capacity to focus on school. They act out because they don't know how else to cope.
Another serious but often misunderstood impact of this crisis is chronic absenteeism. Chronic absenteeism, defined as missing 10% or more of the school year, is on the rise across Minnesota. And while it's easy to assume that students simply need to show up or someone just needs to pick up the student, the reality is so much more complex. For many students, severe anxiety and school avoidance make attending school feel impossible. These are students who wake up each morning with overwhelming panic, who struggle to leave their house, and who experience such intense distress that they would rather face consequences than walk into a classroom. Others struggle with depression and lack of motivation. Getting out of bed, getting dressed, and engaging in schoolwork can feel like climbing a mountain with no end in sight. And then there are students for whom school avoidance is not a choice. It is a symptom of trauma and instability at home. We have students who are homeless, living in motels or shelters, sleeping in cars, or couch hopping with relatives. These students are not skipping school because they don't care about their education. They are simply trying to survive. Others avoid school because of bullying and social isolation, particularly our LGBTQ+ students and those with disabilities, who face higher rates of harassment and discrimination. The Minnesota Department of Education reports that chronic absenteeism has nearly doubled in the past decade. In some districts, more than 40% of students are considered chronically absent. And we know that when students disengage from school, the consequences are severe. Students who are chronically absent in early grades are 4 times more likely to drop out of high school. Attendance is not just about getting students in the door. It is about addressing why they are missing school and providing the right supports to get them back on track. This is where school social workers play a critical role. School social workers help identify at-risk students early, before chronic absenteeism leads to academic failure, disengagement, and increased mental health crises. We provide individual counseling, crisis intervention, and support plans to help students address the underlying emotional and psychological barriers keeping them from school. We work directly with students who are struggling with anxiety, depression, trauma, and suicidal ideation, ensuring they receive support before they disengage completely. School social workers are highly qualified mental health professionals and practitioners who are duly licensed by the Minnesota Board of Social Work, and we are required to be certified by the Professional Educators Licensing and Standards Board, also called PELSB. School social workers at the master level receiving clinical supervision or holding clinical licensure are prepared through their education, practicum, clinical supervision, and licensure to provide clinical mental health services in a school setting. Social workers training includes specialized preparation in risk assessment and intervention, cultural diversity, systems theory, social justice, consultation and collaboration, and clinical intervention strategies. Many families want their children to attend school, but do not have the tools or resources to support them. School social workers engage with families to help them understand their child's mental health needs and connect them to outside resources. We conduct home visits to address barriers and develop attendance action plans that address mental health, transportation, housing instability, and other challenges. When students are in crisis, school social workers coordinate care with hospitals, mental health providers, and school staff to develop reintegration plans. We ensure that students returning from hospitalization or treatment programs receive a smooth transition back to school with appropriate accommodations. At the core of social work ethical principles and the work that we do daily is the belief that people, children included, will do as well as they can given their circumstances. By focusing on building relationships and fostering resilience, school social workers help students feel supported, understood, and capable of overcoming the challenges that interfere with their learning. This compassionate and systemic approach ensures that interventions are not only effective, but also empower students to thrive. As a school social worker, I have addressed barriers to school success in many situations. One example highlights the critical role school social workers play in improving attendance. We had a student at our school and their siblings were enrolled in another school. On the surface, it appeared that the student simply didn't want to come to school. But when I became involved, I focused on building a relationship with the student and their family. Through trust and rapport, we identified the root challenge, which was the mother's unaddressed mental health needs. The father worked long hours, leaving early each morning, while the mother, though loving and supportive, struggled with her mental health. By connecting the family to county resources and mental health support for both the mother and one of the younger children, we helped them address these underlying issues. This support system, combined with the relationship we built, empowered the family to seek help when needed without feeling judged or criticized. This holistic approach not only improved attendance, but also fostered long-term stability and well-being for the entire family.
So what happens when we recognize these issues and try to get students help? Unfortunately, too often, there is nowhere for them to go. Families seeking mental health support for their children often wait months for an appointment. There are simply not enough inpatient mental health treatment facilities for youth in Minnesota. As a result, students experiencing a crisis end up stuck in emergency rooms for days, weeks, and even months because there are no available beds. Imagine a child who is suicidal, who has reached the point of crisis, sitting in an ER for weeks, not receiving treatment, not getting help, just waiting. And even when students are able to access care, they often struggle to reintegrate into school, creating a cycle of crisis, hospitalization, and disengagement. School social workers try to support these students, but with caseloads of 600, 800, even over 1,000 students, we are stretched too thin. The National Association of School Social Workers recommends a caseload of 250 students per social worker, but we are nowhere near that. Despite these challenges, I firmly believe that we can turn this crisis around, but we cannot do it alone. We need you, our legislators, to partner with us. We urge you to take actions in the following ways. First, we need increased funding for school-based mental health services so schools can hire additional social workers, school counselors, and school psychologists. Second, we need to expand access to community-based mental health treatment, including inpatient and residential treatment options, teletherapy services, and crisis stabilization programs, and adequate reimbursement rates for providers. Third, we must reform attendance policies to reflect the reality that many students are missing school due to untreated mental health conditions. Punitive truancy policies do not solve the problem. We need mental health-informed interventions that address the root causes of school avoidance. Finally, we must prioritize prevention and early intervention, including school-linked mental health services, trauma-informed practices, and social-emotional learning programs. Every student in Minnesota deserves the opportunity to learn, to grow, and to thrive. But right now, too many are struggling in silence, and too many school mental health professionals are stretched beyond capacity trying to help them. We can't afford to wait. Our children are in crisis, and they need us to act now. I urge you to join us in this fight. Thank you for your time and your dedication to the well-being of Minnesota's students. We truly appreciate it. We are very happy to answer any questions.
Thank you. Members, questions? Senator Duckworth.
Thank you, Mr. Chair. I appreciate it. Thank you both for being here and sharing this information. I think it's an interesting concept to look more at what resources might be available via tele-support or remote. I think we've had some conversations about that in the past and probably warrant visiting again. But my specific question for you is regarding solutions, create policies to address chronic absenteeism. Are there certain ones that you have in mind or that you have seen be successful in some districts that are worth maybe sharing or talking about a little bit here today? Or is that something that you could maybe provide us at some point as we do look at what policies we might consider encouraging or implementing for districts to help with absenteeism in particular? Thank you.
Do you have any kids, you know?
I don't know of any, but I think we can get them something.
Yep. We can get you that information. I know that there are districts from around the state that have been doing some specific interventions that are specifically related to mental health, and we can absolutely get those for you.
Senator Duckworth's local newspaper just did I'd say it's 2 articles, right?
Yeah, I have it for you.
I already printed it off. Thank you, though. A great 2 articles on student absenteeism, and so I know his district is very passionate on that issue and trying to get our heads wrapped around that particular topic. Senator Kunish?
Thank you. And to kind of piggyback on what Senator Duckworth brought up, we, in education finance, we did finance a pilot group last year. We chose, I believe, 12 schools from around the state, and we were very strategic in choosing those schools, looking at, first of all, which one of those schools had high levels of absenteeism, and then what sort of services that they had available to themselves or not available to themselves at that time, and then, of course, the location. So they're located pretty well spread out across the state, and all summer long, we listened to a lot of different school individuals, the county, social workers, psychologists, all, and even students. And really and truly, one of the biggest issues around chronic absenteeism is not only transportation, but the lack of motivation to come to school for many of those reasons that you mentioned. And so there are districts that are doing really cool, innovative things in order to encourage their students and working with the parents to get those kids to school. So I would expect that school social workers and mental health individuals would be able to do that. My question is around telehealth. Have you, in your experience, in your other professionals in your profession, have you found that to be very valuable? Is it harder to to work with a student, especially a young person, through the computer rather than individually. And I know in some situations, there's no other choice. You know, if they live way out in Timbuktu and there is no social worker, there is no school counselor, there is no psychologist anywhere near them. Are you finding that to be a valuable tool? Is it like, at least there's that? And so I'd like to hear a little bit more about how that works for students specifically.
Thank you for that question. I think when we think about therapy, it's always best to do it in person. We understand that, but we also understand that there is a real shortage of therapists and social workers. So we just need to kind of look where we can. And telehealth is a way that we can get resources into communities where there's just no one really available for that. In my school district that I currently work in, Eden Prairie, we have an online school, and we do provide our school social work services via online, and we are very successful in doing that. It does seem like it would be harder, and perhaps it is in some ways to really have that develop, relationship. I'm guessing it takes a little bit more effort and time for our school social worker to develop those connections, but we've been very successful in providing those services. I think the other thing to think about is, as you're talking about telehealth therapy, is that for perhaps a high school student, they're able to kind of access those services pretty easily, but if you are talking about an elementary age student, they probably would need an adult that would be around to help them with technology, to make sure that they were staying online and not turning the camera off and doing all the things that kids like to do.
And then we talk about the lack of personnel as far as, the ratio, you mentioned 250 to every social worker. Do you know what the average is right now across the state?
Do you know that off the top of your head?
Not that.
No, I think it varies by district.
I think it varies by district. It also varies by, some districts have only special educators that are social workers and don't work with the general education population. Some have only social workers that work with the general education population. So there's a little bit of that. Of course, I'm sure they see all kids, but they're specifically focused in a particular area. I know that last year I was in a building and I was one social worker to 850 students. I can also tell you that the majority of my work was more reactionary. I was literally putting out fires and doing crisis work pretty much all day long.
Just follow up. So if you had to kind of explain to us what the issue is around staffing, is it that there aren't enough social workers and psychologists? Is it that they are not interested in working in the schools, perhaps because, the salary or some of, these kind of ratios? What would you say is the crux of the matter when it comes to that? Because we did fund a nice chunk of change to increase student support personnel, social workers, psychologists, counselors. And we hear that they're in the schools, or schools were able to hire more people, but we're not really seeing that. And so I'm wondering, where is the crux of the issue here, would you say?
Yeah, it's really interesting because when I first started out a zillion years ago, and I would readily have interns in my building. I would supervise interns from the various master's programs from around. And when I first started doing it back in the early 2000s and whatnot, I literally would have maybe 20 people that would want to come and work in a school, and I'd be interviewing them all, right, for that one spot. And as the years kind of proceeded, I was lucky if I got one that wanted to do it. And I think some of that was exactly about what you were talking about with the pipeline grant, is that what ends up happening for schools is that they are unpaid. And when you're doing your master's internships, it really is pretty much 3 full days from September all the way to the end of May. And for many people, it's just, because it's unpaid, it's just unsustainable. So we have, actually, this is like the first year that we've had like a lot of students that are actually involved and doing, and that is part and parcel because of that pipeline grant, which we are so very grateful for, just to have that. But it's just going to take, it takes time, right? Like master's programs are a couple of years. It's going to take them time to get out and for the next group to come in and to keep that pipeline kind of going. So, yeah.
Senator Bolden.
Thank you, Mr. Chair, and thank you to the both of you for being here and your presentation and for the work that you do. As you proceeded through your presentation, thought it was notable and just wanted to underscore that this really is the intersection of a number of different areas, right? So we have our separate committees, and I sit on this committee, I sit on Health and Human Services, I sit on Housing, but this issue really is the intersection of all of those, right? If we, the work we do to build a patient-centered healthcare system that meets everyone's needs, where people actually have access to the care that they need, access in terms of geography and access in terms of just, finances and all of those ways, as we do the work to be sure that everyone has a safe place to call home, safe, secure, and that impacts this issue as well. And so I think just, as we are doing this work, it is important to remember just that the intersection and the interplay and how this is all connected. So I appreciate you sort of highlighting that, and sort of your recommendations weren't just specific to education, but that, we have to look at the big picture of this. I also was sort of struck, as Senator Kunish was talking about, by the ratios you mentioned of the kind of the gold standard is 250 kiddos to social worker, and many, in your field are having 2, 3, 4 times that amount as a caseload. I don't know if you have the answer to this or if it's a fair question, but I'm wondering about the number of social workers in schools now versus like the ideal number. If every school, if every social worker in our school had a caseload of 250 kiddos, how many people is that we are missing?
Ooh. A great question. I don't know that we have the answer to that, but we can certainly look into it to see how many more people it would be. And I would just kind of echo what Julie had shared earlier, is that we are seeing more people interested in school social work through our organization. And so I think we're moving in the right direction, but yeah, it's a bigger issue than just hiring a few more social workers and looking at some of those other pieces. But yes, we can get that information.
Mm-hmm. I think right now there's approximately 1,800 school social workers from around the state, and about 750 that belong to our organization, and we try to provide all of the kind of the PD and the, advocacy and those things. And really what we're trying to do is just improve the lives of students, ultimately.
Senator Abler.
Well, thank you. This is a really important discussion, and I appreciate it. Does staff know offhand what the base funding for school-length mental health grants is these days? Just a ballpark is good if you don't know exactly.
Mr. Chair and Senator Abler, thank you for the question. Those are actually funded by the Health and Human Services Committee, so I don't have that number in front of me, but I can reach out to other staff in our office to get that for you.
Well, and fine, I am interested, anyway, just was curious about that. And on that committee, we've tried to send some money that way. I don't know if it finds its way into the base or not, but anyway, thanks for that. So I think that David Law was here, and I think he used to represent a different school district, Mr. Chair.
But now he represents a different school.
Yeah, he stole them away. They took our football coaches and our superintendent. So we're still, we're still angry about that. But anyway, independent of that whole thing, I thought his comments, if you would boil the whole day into one testifier, I think he actually boiled it in really well. Tell us what you want us to do, and then measure us on that. And then, by the corollary, then pay for it. If you want us to provide lunches and mental health, well then, see how we're doing with that. Most people, certainly we care about the core academic studies and other things that we've discussed here, but I think that we're not winning the fight on this. And maybe we're asking the wrong question. Maybe in our assumptions we think that the schools are responsible for student mental health, actually non-adult mental health, because the non-adults have a life outside. And so we've done so many things. I was the author of the bill to create licensed professional counselors. And then we jacked them up to be licensed professional clinical counselors. And NOCA district has built their mental health programs based on LPCCs, one in every, at least high school, with some success. We put, over the years, quite a bit of money into school-length grants. And every penny well spent, I think. But I think that it's not, at the end, things are worsening. The statistic that maybe 5 or 6% of the students are considering suicide, it's in the NAMI letter here, that's a lot. And so I think we need to, there was some money for buying new counselors in schools last year, or 2 years ago, that, another effort to try to stem the tide, and there's not enough human beings to take all the jobs you would want. And so I just think we need to really think about this. How are we going to succeed? And maybe we're thinking that the school being the point of this is what we're not succeeding at that. So I think a school should be, the NAMI letter has some points I kind of like this. The school should be supportive and understanding, and they should provide critical supports, in urgent times. But I think if they're going to be the A to Z for what we're going to expect, I don't think that's possible. And there's another letter in the packet from the Parents Alliance, which is actually very thoughtful. And they suggest the idea about engaging parents and guardians. And very often in the industry, parents and guardians are considered like an untrusted partner. There are some parents who are untrustworthy, but the distinct minority. And so the partnership has to be rebuilt, I think. In 120 something, it says the parent is primarily, responsible for the education of their child. And when we did our charter school, we tried to weave a blend of parents and teachers. And it took some years to get the trust to develop there. But I think that if we're going to rebuild this system and actually keep these kids from not causing great harm to themselves and having a horrible life, that I think that's somewhere we need to think about. And I think we should tell Superintendent Law, how much do we expect you to do? And if we're going to expect them to do some things, then here's some money that you can do the best you can with it. Last year, I was proposing that we took some of that mental health money for one bucket and allow it to be spent in different ways by the districts, and that was not successful. But I think we need to consider, if the district has money in the mental health pot, how should they spend it? I've always supported more social workers in schools since forever ago, back in the Madden Tenza days, in the early 2000s. And still we come up in the same, different testifiers, we need more. But so, Mr. Chair, I'm serious. I think we just need to think, are we going to help these young people? And how do we rebuild what we're apparently losing? Because we're slipping down the slope the wrong way. So thank you, Mr. Chair. And I'm happy to be a part of that conversation. But thank you very much.
Senator Kuhn, or anybody we haven't heard from yet today? Senator Kuhnish?
Sure. I have a question for you. Do you know if there are any funding, resources, or grants that come from the federal government that would support, that do support mental health, addressing mental health issues in our educational system at this time?
We were just saying maybe SAMHSA, but we honestly don't know. I think the majority of grants come from within that are addressing the mental health stuff, but
From
Yeah.
within state government or from within the school district or?
From state, from,
Okay.
you know, I mean, it's also a matter of how districts, I think, are planning their budgets. Those kinds of things, you know, some districts, you know, are very lucky, their taxpayer base, you know, maybe has approved a referendum or something like that that has provided more supports, while others maybe haven't been as successful in doing that. I think it's just, I think it's a little bit of everybody's looking everywhere.
And are you hearing any concerns or worries that there might be, you know, the potential for budget issues? When you say you're talking about your budget, is there any discussion about the uncertainty of what's happening at the federal government and funding education that you're already hearing or perhaps having to plan for?
Did you want to answer that? Want me to?
You can go, yeah.
Okay. I think, you know, quite frankly, I think everybody has concerns right now about what's going to happen. I think all of us, even as an organization, we're kind of taking lead from the state of Minnesota in terms of the guidance that and the information that they're putting out. You know, we're listening to some of the national organizations, and I think all of us are kind of in that wait and see mode. But yes, I do believe that there is concern. People do have concerns because, you know, I think what 10% of the Minnesota budget comes from federal money. Is that correct? So yeah, I mean we do, and you know we know who it's going to affect.
And I'm looking here now, but just a couple days ago, and I'm not exactly sure where I need to click to get to it, the page for 504, the resources for students with disability has been taken down at the federal government. Does that mean that the guidelines that were established before are now in question, or is that something that may or does not affect you?
To our knowledge, there's been no changes within the state of Minnesota, so we will continue to follow the Department of Ed's direction, and they have shared that there's been no changes
Okay,
in our state at this point.
great. Thank you.
We're all very lucky to live in Minnesota.
Senator Duckworth.
Thank you, Mr. Chair. This is more so just a comment for what we might consider in the future. This is probably, I don't know, our second or third meeting where speculation regarding Department of Education and the federal government has come into play. And really the takeaway is there's really not much information other than speculation, which can sometimes be harmful. So maybe there's somebody, whether it's MDE or with the department, that we can get in to come and talk about it, so that rather than us speculating and adding to anxiety, or maybe putting information out there that's not accurate, that could come in and speak to that and give us some of that information so that we actually know what it is that we're talking about, or some of the things that we are speculating about publicly, to help alleviate and calm some of the waters out there if that is what people are experiencing. Just food for thought. Thank you.
Thank you. Thank you. both for coming in. Ms. Hofer, if you could get that information to to us and Senator Abler as well, and if you two could get the information request that I believe Senator Bolden asked for, and get that to all of us, that'd be really helpful.
Mr. Chair.
I'm on a roll.
Well, I was going to add to your shopping list.
Okay.
I mean, if,
Is it Duckworth, Senator Duckworth's Lakeville newspaper articles?
you know, we don't even have an absentee problem
Okay,
there.
I shouldn't have interrupted, I'm sorry. Go
No, I
ahead.
interrupted you. But I mean, we've asked DHS to come and tell us the latest. I don't have any way to find out what's going on between Washington and us, but MDE would know with some specificity. So if they could visit us or send us a memo from time to time, I would love that. Thanks.
Thank you, as would, and that's duly noted, duly received. We'll see if we can get them in Monday. Okay. Senator Abler said we are not winning here, and it was the phrase he used. And I feel like our kids listening to you two today are like canaries in the proverbial mine, and that if we can't help them, we're just going to have these increased problems as they grow into adults. And I'm so perplexed and over, I just can't imagine, when you said suicidal ideations are up in grade school students, I just can't imagine when I was in second grade in 1960-something that the state legislature of Wisconsin was sitting around discussing suicidal ideation in our young people. And so I'm begging you, and I'm begging my colleagues today, if any of you have any ideas that A, may not cost any money, and B, might put a dent in this, magic dust, just something that we can say we helped one kid. You know, it's that classic line in Schindler's List, you know, he who saves one life saves the world entire. And if what comes out of this meeting is some idea that would help one kid, and I just don't know what that is, but we need to come up with ideas, and I know in your PowerPoint you had some suggestions, but I just don't know. You know, I know, and the Counselor of the Year may be touching on this, but when I first came into this body in 2017, we were 44th or 46th in the nation in student-to-counselor ratios, and I thought with all the funding that committees like Senator Kunish's has given our school districts, that the number has improved, and in fact, we've gone backwards. And so so if you guys, in your closing remarks, but please keep them brief, if you have any ideas for us here and now, or if my colleagues have an idea or some epiphany in today that you want to craft some bill and we can get this heard and pass it into law to help one kid have a better life, and I just don't know what we can do. We need your knowledge and your wisdom and your assistance in helping our kids. And as I said, if we want every American citizen to get to the top of Maslow's hierarchy of needs of self-actualization, it starts in pre-kindergarten. And so whatever the cause is for this increase in mental illness in our youth, it came upon, and we can eradicate it. And maybe someone in this audience will be Time Magazine's Person of the Year because you figured it out. But let's help our kids and let's get this right. And anyways, sorry. Senator Mayquade.
Thank you, Mr. Chair. And I think, you know, the things that I'm about to say, most of them don't take place in the school. So there's been bodies of research. Lancet just published at the end of last year. One of the key factors in mental health for young people is wealth inequality. It tracks pretty closely the wealth inequality because no matter your income bracket, because when you go to school with kids who don't have what you have or have what you don't have, it actually takes a toll on your mental health. This Parents Alliance letter is a perfect example of things that bully children. trying to discredit the existence of trans kids that makes people feel like not living, and it makes them feel like not coming to school. And the thing about suicidal ideation, especially in children, but this is true in adults too, is that they don't know what it's called. They don't know that it is a mental health issue or that there's treatment or that they can talk about it, because all they're thinking to themselves is, I don't want to be here anymore. And there's a bunch of people at this school who tell me every day that I shouldn't be here, or I shouldn't be how I am. Or they get text messages after an election saying, we're going to pick you up for your cotton picking shift because slavery is back. These are the things that take a toll on our kids. And then you add in gun violence, which is the leading cause of death with children, and especially school shootings, climate change, the unregulated tech industry having constant access to our kids all the time to monetize their attention and their lives and steal their faces to make AI. Of course they're struggling. Almost none of that is in this committee. It touches a bunch of other committees. And so then we have social workers, and we'll have counselors, and we'll have educators, and we'll have parents, and we'll have kids who are gonna come in front of us and they're gonna tell us how hard it is, but we're talking to the people who are just dealing with the mess that like billionaires created in our country by stealing our wages and cutting our health care and, you know, making us addicted to cell phones. And I'm sorry, but the counselors are like, can we just have a few more of us to like help the kids in schools? Like most of it is not this committee. And it's not gonna be a solution that we're gonna find here. But we have to listen, because a lot of what we do as elected officials, as leaders, the bully pulpit that we use matters. When you have people telling kids that they matter, who they are is real and beloved, and that they have inherent worth and dignity because they are here, that matters. And when we say the opposite, it also matters. The Trevor Project did a study that showed that every time a legislature considers an anti-trans bill, the suicidal ideation in trans kids goes through the roof, and they get more calls and more die. And so, like, I'm just saying that the things are not unknowable, just most of them aren't in this committee. And so if we're gonna do right by these kids who are gonna become adults, then it starts with a lot of things that we, you know, wanna call partisan or wanna call controversial that actually aren't to the broader public, but it's what's making kids not wanna be here. Whether it's get up and leave the house and go to school, or whether it's like be on this planet. And I want those kids to know that we want them to be here. Whoever they are, however they are worthy and valid of being here. And I know that's the work that you do every day too. And we gotta teach kids how to be kind to each other, because they look at us and they reenact that, right? That's the whole part of being a kid, is you just reenact what you see. And so we're seeing them do that, and it's not going very well. So, not groundbreaking, lots of studies, lots of literature about it, but that's where we are.
Thank you, members. Senator Wiesenberg.
Thank you, Chair. I don't think it's really appropriate to say that slavery and cotton picking are back. That's offensive. That's not true. That's out of line. That's all.
Mr. Chair.
Senator McQuaid.
Thank you, Mr. Chair. I agree. I am repeating the text messages that Black students in this state got the day after the election. It was very offensive, and they were terrorized. But those are the text messages that Black Minnesotans, including students, received after the election. It was very inappropriate.
Senator Wiesenberg.
I think if we're going to, thank you, Chair. I think if we're going to talk about social media, we should have these conversations between the adults and not have this in front of the children, because you're talking about, yes, on Monday you talked about how social media is hurting children, and I agree with you. But then let's have this conversation. Now you're telling this to people. We need to work on saying people are equal, and that's what people are. We're equal, right? But now you're going and putting this out there, and kids are hearing this, and it is now hurting kids more. So let's have the conversation. Let's do this, and not like you're attacking people, and it's not fair to attack people. Now let's all get along. Let's all get in the room, and let's not be saying these things. And there's things that you said that I don't agree with that I think are hurting kids' mental health. So when you say that, now you're confusing kids more.
Final closing comments, you two. Keep them brief, though, if possible.
I'll be super brief. So you had offered the invitation for us to come and do some work around how we can help solve, we are absolutely willing to partner with you on that. And I am sure our school counselors and our school psychologists are there too. I had mentioned about those 20 students that we did risk assessments on, and what I want to say is what we can do, it's to build those relationships. Thank God we had school social workers that were taking the time to listen and to assess and to call their parents and make sure that they were going to be okay. So, you know, that's just the little glimmer of hope that we have caring, lovely people that are in our buildings that are doing that work every day. We just need a few more of them. That's all. Did you want to add anything?
Thank you both.
Thank you.
For your testimony, and thank you, members, for the questions and comments that you brought on today. Counselor of the Year, come on up. And one of the things I hope to hear from the Counselor of the Year, is not just what issues our kids are facing, but we bestow this honor of Superintendent of the Year, Teacher of the Year, Bus Driver of the Year, Counselor of the Year upon people that are doing all the right things in our schools. And so you have earned this honor because your colleagues have deemed you as being the counselor that best exemplifies all the traits that we need in counselors. So we'd like to hear what it is you're doing right, and with all that said. So with that said, thanks for coming in, identify yourself, and make sure you sign in for the record.
Thank you, Mr. Chair. My name is Sydney Paris. I am a school counselor, and then I also represent the Minnesota School Counseling Association. And as he said, I have been elected this year's School Counselor of the Year for the state of Minnesota. So again, thank you so much for having me. The piece that I would like to start with is hopefully some good news. I feel like after that last time, it was kind of tough. And so to share hopefully a little bit of anecdotal positive things before I go into that aspect of why I was selected and the good work that we're doing is, as a school counselor, one of our roles is, of course, supporting students with their academics. So sometimes that is helping them learn how to do study skills, how to take notes, how to be organized, those kind of executive functioning skills that, I don't know if you all know this, but don't usually develop until later on in your teens/early 20s. And so sometimes we are asking our students to do things that cognitively they are not able to do, and yet that's the expectation. And so for a lot of them, we're having to help support that and encourage them to build those skills. In addition to the academics, we also support students with social and emotional pieces. Sometimes that is, hey, I'm having a conflict with a teacher. Hey, I'm having a conflict with a peer. Sometimes it is, hey, I'm having a hard time at home. My parents are going through divorce, and I just need someone to talk to about that because, you know, mom's saying this, dad's saying this, and I don't have an adult that I can go to. So sometimes it is social emotional things that are peer-to-peer. Sometimes it's peer to staff, and then sometimes it is, you know, peers with parents, or kids with their parents, and sometimes it's even like coaches, right, or jobs and having conflict at work. So those are two of the pieces that we do, but then also college and career guidance. And that's the one that I kind of want to start with. A good story is thanks to the work that we've done, that you have all done within the last couple of years, there's the North Star Promise Act, right? In addition to that, we also have direct admissions. So to share with you a story, I had a senior this year who is one of the most amazing students that I've had the pleasure of working for and with, is beyond creative, does some beautiful slam poetry, has some amazing insights, and is just gonna be one of the most awesome young adults that we'll have coming through the state. And I hope that they stay here and don't go to a different state. Now, all of that being said, this student, for a variety of reasons, has had a hard time attending school, right? Sometimes it's been bullying, sometimes it's been, staying up late, sometimes it's been mental health related, sometimes, it's a variety of things over the course of their high school and obviously early education experience. All of that being said, they came to me and was like, I don't know what to do after high school. I know I can't go to college. I was like, what do you mean? And they were like, well, I'm not college material. They self-selected themselves out of college. And thankfully, we partnered with Direct Admissions this year and offered that program. And I was like, hey, let's actually take a look at your email and let's see if there's happens to be something in there. So we find the email for Direct Admissions, and I say, hey, just take a minute and look through it. So she starts reading it, and then I can see this emotion coming over her face. She starts getting these tears in her eyes, and she looks at me and she says, you mean I've already been accepted to 20 colleges in the state of Minnesota, both 2-year and 4-year? I'm like, yeah, you've already been accepted. All you have to do is finish the application. You see there's that little link in there. You just got to click it. And like I said, the emotion, the excitement that she got, she self-selected herself out of college. And it had nothing to do with something I said, right? Whether we know it or not, our students, our kids, people out in the community, they are taking in those messages, whether we're saying them verbally, hey, you're not good enough for college, or if we're not saying them verbally, but policies or other types of comments that they're getting out there are implying that they're not college material. If I don't have good grades, I'm not college material, right? So for that student, that was paramount to them being able to start their college adventure, and now gets to make the cool decision instead of being like, I don't even know if I'm college material, now gets to make the choice of which college do I want to attend. And that's the beauty of the work that, you know, myself and others do, as well as you all. And I hope that that's some of the work that we can continue doing, right? But you wanted me to talk first, more so about School Counselor of the Year and how that gets awarded. And so across the country, we have the various states and territories that nominate School Counselor of the Year. Within the state of Minnesota, each year, a elementary school counselor, a middle school counselor, and a high school counselor are selected. You are selected based off of an application process that includes letters of recommendation from your bosses, from parents, from students, and any other staff members that you work with in or outside of your school. I was, I guess, gracious enough or thankful enough that I ended up getting letters of recommendations from parents, from students, school board members, as well as private therapists out in the community, students, all of that jazz. In addition to those letters of recommendation, the applicant fills out some other work that they've done outside of the school or even inside the school. So all of the work that we've done in the school in terms of increasing our graduation rates, decreasing failure rates, increasing attendance, all of that gets taken into account. But then any kind of work that you've done outside of the building to advance your profession is also taken into consideration. And so a couple of you alluded to the student support aid personnel bill, and that was one that myself and then many of the other professional associations like the school social workers, school nurses, and school psychologists came together to help support that, help kind of clarify some questions around it. And then again, it eventually did get passed thanks to you all. And so that was taken into account, and one of the pieces with that I really want to highlight is part of that aid was on the workforce pipeline. School counselors are in a unique position, and we do not have a shortage in the state of Minnesota. That is unique to other professions that I just mentioned. What we do have is a lack of attractive full-time positions. Many of the school counseling positions in the state of Minnesota are part-time or are split between multiple buildings, right? And so that is what we do see from staff is because there's not full-time, enough full-time positions in the state of Minnesota, our school counselors that are licensed here are leaving and going to Wisconsin, Iowa, South Dakota, and North Dakota, where student-to-school counselor ratios are significantly smaller by over 200 students compared to Minnesota. So all of that was considered as part of my application and why I was awarded the School Counselor of the Year, both the work that I'm doing individually and as a team at our high school, but also the work that we've been doing at the state level as well for advocacy.
Thank you and congratulations. Members, questions, comments? Senator McQuaid?
Thank you, Mr. Chair. I don't think I learned what school you're at or what grade level you're at.
All of the things. I am a high school counselor at Stillwater Area High School, and I work with students in 9th through 12th grade. We do an alpha split, so I have all of the kids that are in a certain letter range, 9th through 12th grade, including our students at our ALC program and our special education bridge transition program as well.
Senator Abler?
Yeah, thanks. Thanks for coming. And I appreciate in particular that, whatever it's called, that you get to go to college and here you get to go program, direct admissions. Is that in our base? Is that permanent? Is it somebody else that pays for it? Or it just seems like something we really need to have go ongoing if it's not.
Yeah, it's a grant fund as far as I'm concerned, and I believe it's been funded through the 26 or 27 school year. But that would be an excellent program to continue moving forward.
Yeah. Mr. Chair, I agree. So thank you. Thanks for bringing that up.
Yeah, thank you, Senator.
Senator Kunish?
Thank you. You mentioned that one of the biggest obstacles is that school counselors and psychologists are not hired at a full-time rate. Is there anybody out there that can speak to this? Any of our superintendent groups or principal groups that can help us understand why you wouldn't be hiring these individuals at a full-time rate if it meant that you could keep them in the schools?
Senator Kunish, I have the numbers, if that's helpful as well, for all of the positions. And so we have over 1,600 school counselors that are employed by the districts in the state, including private schools. And then in terms of the actual full-time positions for them, we are looking at about a total of 1,600, and that includes all of our part-time positions. And so right now what we're looking at is more than half of our school counselors are part-time.
And again, is there anybody out there in the audience that could maybe speak to the reason why you would hire part-time rather than full-time, other than, you know, it's going to cost a little more to include benefits and all of that sort of thing? If there are full-time counselors and psychologists and those people that would address mental health issues that would like to work full-time, why are we not hiring them at full-time?
Identify yourself and thank you.
Thank you. Thank you, Mr. Chair. Members of the committee, my name is Valerie Dosland. I represent the Minnesota Association of School Administrators. I'm speaking on the fly. I don't have a lot of information at our fingertips. One thing I know that we have heard from our members, especially the members in Greater Minnesota, is the student support personnel aid that was provided. The minimum aid guarantee is often not enough to hire a full-time support personnel staff, so that could be one reason. Another reason is there's a shortage of licensed staff, and so maybe that is another reason. Districts may be sharing one full-time staff between buildings. Again, we'd have to do some more digging. I'm just sharing what we have heard on different regional meetings with our members.
And I would just follow up with that. That aid was not necessarily, was to encourage you to hire more teachers than are already situated and to expand on that. And so I'm really curious if there are those out there that would like to work full-time, perhaps not be split between buildings or be, have to travel. What is keeping the schools from hiring those individuals full-time? Thank you.
Mr. Chair,
I just want to thank you both for coming up
Yeah.
on the, as Ms. Dolson said, on the fly. It's pretty courageous to come up when you weren't expecting it, so thank you.
Mr. Chair, members, and Senator, I actually did put a quick call in just to Bob Driver, the Executive Director of the Secondary Principal Association, to specifically ask your question. As you know, he was testified the other day as former principal in St. Michael, and he said we would always hire full-time counselors. It's just a question of the economics of it, but actually he did not know of any trend where we'd be looking to in any way kind of minimize that. I mean, and I think the position of our association is probably the same as shared by our counselor of the year here. It's a position that we need to protect, foster, and support is where we would be on that. But there was no underlying process that, hey, we need to split this up into positions of less than 1.0. We share them from time to time, you know, with another spot, and maybe they get accounted for in different budgets. Something might be in one school's budget and another school's budget, particularly in our larger school districts, where, for example, next week, Minneapolis principals will be getting their budgets, their site budgets, and so they'll look at, could they buy a 0.5 counselor? Could they buy a 0.75 counselor? That's part of where that comes in, and they might look at buying a 0.5 assistant principal in that same kind of economic squishing that goes on with budgeting. Well, I hope that helps answer your question a little bit. Yeah.
Can I build off of that as well?
Yeah.
Thank you so much. So I was speaking specifically from the school counseling lens. We, as school counselors, don't have a shortage. However, there are shortages in the other areas. That being said, what is happening with the minimum was the 40K. And when you're talking about hiring school psychologists, school social workers, school nurses, counselors, our minimum, specifically for counselors, for example, in order to do this job in the state of Minnesota, minimally, you need a master's degree. So when I went to college, I tried to be smart about it. I started at a 2-year college. After that, I transferred to a 4-year college. I am one of the unique ones that did actually get done with their 4-year degree in 4 years. Recent research is showing that it's taking students somewhere between 5 and 6 years to graduate with their bachelor's degree. So I was one of the kind of unique ones, and then went right into grad school as I was working part-time at a domestic violence shelter. After I got out of grad school, I was lucky enough to get a job right away, and my starting salary was under 40K, and that included benefits. So in order to do the job that I do here in the state of Minnesota, to start with, I took on how much debt to be able to do that kind of job, and then I was paid a fraction of the debt that I took on to do that. And so in terms of that 40K, it does need to be increased, because we're unfortunately, when, you know, again, a teacher can come in and have a bachelor's degree, and it is, you know, 40 to 50K, not great, but it's a little bit more manageable. If you're having to go to school for longer, a starting wage of under 40K for a master's degree is not acceptable. So yes, increasing that 40K to somewhere around 80K would drastically help school districts hire full-time staff. So again, to their point, those tough decisions are having to be made financially, and oftentimes there's not enough money to do it at a full-time position.
Thank you.
Thank you for coming in. 2 final questions, and they're really easy. Is there a National Counselor of the Year? And what is the status of you in that, in being recognized for that? And the articles that the pages just passed out are from Senator Duckworth's local newspaper, so even they are acknowledging the importance of some of the things we're hearing. So thank you for coming in and for the last question.
Thank you for that question, Mr. Chair. So there is a School Counselor of the Year for the nation, and they are from Florida, and they've done some amazing work, especially in that state, and are an amazing human being. And we actually all just got back from DC, which is where we had the annual celebration for the School Counselors of the Year. And so we were able to go to the Capitol, met with legislators as well there. And then we also had a really cool celebration. We met with the Marines as well, and so it was a really cool experience. And one of the things that I took away from that was the work that the counselors here in Minnesota are doing. Even though we are ranked towards the very bottom, right, in the caseload size for across the nation, we're ranked at 48th right now. We are doing some amazing work, and some of that work, for the most part, is proactive. We are trying to get ahead of things before it becomes an issue. We're trying to teach students how to resolve some conflicts without going right to, hey, we're going to take this outside and fight, or usually in the school building, we're going to fight. We are trying to equip them with the skills to make sure that they can navigate interpersonal conflicts, especially because one day they're going to be in our workforce, and that's not going to be okay in the workforce, right? And so we are trying to be proactive with things, and the type of work that we're doing here is good, But the work we could be doing if we were closer to that ratio mark would be night and day different. I've been in a state where I've had that closer to 250 to 1 ratio, and it is night and day the kind of work that I can do, and I'm already pretty darn proud of the work I do, and yet the type of work that it could do with lower caseloads is night and day difference. And one of the things I wanted to touch on that some of the other folks shared was regarding mental health and attendance. So for example, last year we had 21 students at our high school that at some point during the school year had to leave to address their mental health needs, whether that be inpatient treatment, partial hospitalization, that type of thing. We had 21 total students through 9th through 12th grade. This year we're already at 22 and we have 4 more months left of school, right? And we're already past the amount that we were last year. Now, in addition to that, some things obviously do need to change. We need to get creative with how we're doing attendance. I think one of you, Senator Quaid, I think you mentioned about that when we talk about attendance and we talk about mental health, we're not talking about poverty. And when you look at graduation rates, and if you try to look at based on demographics, if you were to look at graduation rates for special education students, if you would look at rates of students with multi-language learners, if you were to look at students that are identified as gifted, any of those types of things, most districts, your student population that is most at jeopardy for graduation are your students that are in poverty. And if we don't find some ways to help support them, whether that's in the schools or outside in our community, we're gonna further stigmatize them and further eliminate an amazing workforce that can only get hopefully better. But we're gonna take them away from that by the stuff that we're doing in the school and even outside of the school. And so I just wanted to share a couple of pieces in terms of attendance. I know one of the things that we've seen at our school, and I think that other schools have seen as well, is since the inauguration, we've seen a huge decline in our attendance rates for our Hispanic students. So if we looked at their attendance rates before the inauguration, and then we looked at them since, we've seen a 3% decrease. And so students are reporting to us, whether it's you agree with it or not, whether your opinions are in line with theirs or not, it doesn't matter. But what students are sharing with us is that they're scared to come to school, whether it's because of their own safety or they're scared to come to school, go home and find that their parents aren't there. And again, whether or not that's a reality or like a real thing that could happen, that is their belief. And unfortunately, within a lot of their communities, a lot of their families, they may not always have access and the education that you all and that I have. And so fear can populate and spread like wildfire within those communities. And so we are seeing a huge decrease in their attendance already, and it's only been a few weeks. And it is, we talk about ratios quite a bit, but the fact of the matter is certain groups of our students are gonna need more of our attention than others. And that's how you want society to kind of work. You want some people that are able to kind of manage and navigate some things and can kind of figure it out themselves and already have some supports that might be outside of school, like super involved parents that have gone to college already, know the ins and outs of it. But then we also have this group of students that they don't have that. And the harm that we are causing them by how we are talking about things is significant. Again, whether or not you agree with that or what your political belief is, those are the lived reality experiences that these students are talking with us about. And I don't want to diminish their lived reality or their experiences. So I just wanted to kind of share those last pieces with you all as well.
Again, thank you for coming in, and congratulations again. Next up, we have 3 testifiers that will be talking about the contemporary issues impacting the mental health in our students today. Senator Kunish.
I am Senator May Quaid.
Senator May Quaid, I'm so sorry. From the bottom of my heart, I apologize. I know. Senator May Quaid.
I do not mind being confused for Senator Kunish. It's a compliment. To Senator Kunish's earlier question about federal funds, Title IV funds are used, 20% of them have to be used for improving student mental health, behavioral health, and comprehensive social, mental, behavioral health service delivery, trauma-informed policies and practices, bullying and harassment intervention. And so on the MDE website, it's available. So the top 10 schools who use Title IV funding for this, Elk River used 99.85% of their funding for safe and healthy well-being, Wabasha Kellogg 98.7%, Belle Plaine at 98.2%, Glacial Hills Elementary at 98%, Wabasso Public School District 97%, St. Michael Albertville 95%, Rocori 93%, Northfield 93%, Eden Prairie 93%, Fairmont 93%, Mesabi East 92%. So of the schools who are receiving Title IV funds, those are the ones who are using almost 100% of those funds for student health and well-being at school, whether it's mental health or harassment, bullying interventions. There are federal funds that go to that. And as we learned in the Education Finance Committee, the district pays out for that first, then the state reimburses the district, and then the federal government reimburses the state. And so, you know, to Senator Duckworth's earlier point, like the reality of the uncertainty is now, and we're hearing that from districts. And I think it's important that as we have these conversations, like we could lose more support or be out the money for support we already provided if the uncertainty continues or if funds continue to be withheld. And so that is important context for this conversation.
Mr. Chair.
Thank you. And if I just...
It's just a quick follow-up.
Yeah, Senator Duckworth, go ahead.
Thank you. If at any point in time we could hear from MDE or anybody that a single dollar that is supposed to be allocated from the federal government has not shown up, that would be helpful information. I get that the federal government obviously plays a role in funding our schools, and what I hear from folks is it's not helpful when at our level we keep saying that funding is not going to come, when in reality that hasn't even occurred yet. So if that has happened, please let us know. But if it hasn't, let's be very careful about how we talk about it, and let's not over-alarm folks or cause anxiety for no reason if something hasn't even happened yet. That's all I'm trying to say about future meetings. And the other point I would make is, because our schools have already had enough of that over the last 2 years in terms of unfunded mandates. They know all about it.
We'll try to get somebody from the department in, and make sure you bring that question up when they're in. And I know members have other places to go, and sometimes they don't stick around till after the final speaker. I just want to remind my colleagues, if in today, or having read the articles from the Dakota newspaper of some of the letters that are in our packets, if you guys have ideas for bills, again, that don't cost anything, please get them drafted and get them to us so we can continue our work. So identify yourself for the record, sign in, and welcome to the committee.
Thank you. I am Kat Rohn, and I serve as Executive Director for Outfront Minnesota, our state's largest LGBTQ advocacy organization. And I am appreciative of the opportunity to share a little bit more about our community's experiences in the current landscape. I know I've had some conversations with a number of you already around this, but our organization has worked within the state since 1987 through many shifts in both political and cultural climates under varying presidential administrations. And, you know, I have to reflect that this present environment has been uniquely challenging. And we are seeing both rhetoric and action that are having significant impacts on the health and well-being of our state's LGBTQ youth that are reflective of the national climate. The Trevor Project's 2024 U.S. National Survey on Mental Health of LGBTQ young people, which was conducted prior to the election, found that 90% of LGBTQ young people said their well-being was negatively impacted due to recent politics. And unfortunately, that landscape is worsening. Since Election Day and post-inauguration, our organization has seen an uptick in calls from educators and families seeking support and guidance in a shifting landscape. We've engaged with families who have moved both from outside of Minnesota to the state and actually within our state to what they perceive as more supportive districts. And we've heard escalating incidents of harassment and violence targeting LGBTQ youth or youth who are perceived to be members of the LGBTQ community at all levels of schooling. A West Metro family shared with us, "The morning after the election, I knew our eldest was going to take it the hardest. I found them crying. They were sure that their medical care would be made illegal and canceled. They started telling me about their suicide plans in despair. I feel like we're lucky because they told us so we could act. But our school district doesn't act on trans bullying sufficiently, so we don't feel they're safe at school. Other states are allowed to discriminate against our family, effectively having the portion of the nation which we can safely travel to, or colleges our kids can choose. I'm a veteran who served my country for more than 2 decades. Now, we're in a heart-wrenching discussion about whether we need to get visas to live in a different country to keep our families safe." Families in our communities are not just grappling with the policy impacts of a string of executive actions around federal recognition in identity documents, protections in schools, inclusion in sports, access to healthcare, military service, and federal civil rights enforcement, but they are feeling the impacts of harmful and dehumanizing rhetoric. An educator in southern Minnesota shared, "Our high school has seen a drastic increase in LGBTQ targeted bullying in the last few months. I have had students share that they are being followed in the hallways as people whisper about their identities as mental illnesses, and that kids are going to be locked up for who they are. GSA materials were vandalized by students claiming to be, quote, enforcing the president's laws." While we recognize that there can be disagreements about policies in these areas, the tone of these discussions, particularly on the national stage, is having real impacts on our students, families, and communities. This should not be a partisan issue, and we urge elected officials, educators, families, and individuals in our communities to continue to uphold the inherent dignity of our LGBTQ youth and to affirmatively support the needs of our students. I know that we as a state have a capacity to do that. Minnesota has made great strides to address violence and discrimination in our state, but gaps still persist for LGBTQ students. Minnesota Student Survey data from 2022 identifies that LGBTQ students are the most at-risk population for bullying and harassment tracked in that survey. Nearly 2/3 of LGBTQ ninth graders reported being bullied at least once a month in schools, and nearly 1 in 10 reported daily harassment. Addressing the needs of our state's youth will require engaged approaches, community partnerships, and real commitment from our state's leaders and institutions. We must affirm our state's commitments and protections, support mental health needs of our youth, and ensure that our educators and our communities at large are committed to preventing bullying and harassment so all youth are safe. A family in the East Metro who previously had to leave their home school district because of a hostile climate shared this experience from an extracurricular class. After the election, 2 students began making negative comments about our child. Our child asked them to stop, and they would, but the bullying would start back up again at the next week's class. My child didn't share this with me at the time because they hoped that it would be better after winter break. But when classes began again, the bullying was worse. One day, my child left the class in tears, and this is when they finally told me about what was happening. The program responded amazingly when I reached out, better than the schools ever did with bullying, so that was something. And we know many educators, families, and fellow students are stepping up in meaningful ways. A school administrator in the West Metro was candid with me in sharing, "The best words to describe the past several weeks are chaotic, traumatic, scary, and exhausting. We have been working at a fever pace to try and interpret what these executive orders mean for our district with zero help or guidance from MDE. The culture in buildings is tense as teachers ask if state standards have changed. Do they have to change their reading lists? Are we pulling books from libraries? Can the GSAs still meet? What about the safe space stickers? Are they going to get reported for caring for and loving their students for who they are, pronouns, gender identities, and all? We are holding the line because we know those are our values and we know the law, but we are having to be extra vigilant right now to keep all of the kids in our spaces, and it's all hands on deck. For so many kids, school is the safe space. Let's ensure those safe spaces remain here in Minnesota. LGBTQ people are part of every community across this state, and LGBTQ students are part of every school district in this state. In this moment of uncertainty and fear, they need our support. I hope we can all step up and affirm that and take proactive steps to address the needs, both immediate and persistent, that face our communities. Thank you.
Thank you. And we're going to, if you don't mind, hold off on questions and comments. We have two final speakers that are both remote, and then we'll hear from the members of the committee. So is Christy Hall or Natalia Benjamin out there somewhere?
Good afternoon, Chair. Can you hear me? This is Christy Hall.
We can, thank you.
Good afternoon, Chair Swedinsky and members of the committee. My name is Christy Hall, and I'm a senior staff attorney at Gender Justice. I represented multiple families with transgender youth in Minnesota schools. Transgender youth and other LGBTQ plus youth face a disproportionate amount of bullying in Minnesota schools. And that bullying, and I've seen it in my own cases, can lead to absenteeism in schools, can mean that students end up transferring to online-only schools, and it can contribute to increased contact with child protective services and the juvenile justice system. Transgender youth have better mental health when they are in affirming environments at home and at school. And social science research shows that bullying and harassment are inhibited when there are clear directives from the top of an institution that bullying is not tolerated here. When superintendents, school boards, principals, teachers, etc., are aligned on that, students can thrive. We also see an increase in complaints of bullying anytime issues related to transgender people are in the news, or anytime there are waves of anti-transgender legislation passed. And I just want to echo what Kat Rohn was speaking about as well. The difference in the past few weeks in what we see is stark. Schools are struggling, students are struggling. We are concerned about those mental health effects of the recent executive orders from the Trump administration. Transgender students and students from immigrant families are particularly affected by these and may be afraid to even go to school in the current environment. And I can personally see the difference on social media as social media organizations like Meta, which is Facebook and Instagram, have changed their policies and algorithms to allow increased targeting of transgender people. So students are seeing more anti-LGBTQ plus bullying online, in social media, and in classrooms from their peers. That stuff filters down and it has an impact, and it needs to be strongly counteracted from our state institutions, including the legislature and state agencies like the Minnesota Department of Education. Students are also hearing that they may no longer have access to sports that align with their gender identity. Participating in sports is important for mental health. There are existing laws related to bullying in schools that can protect students in Minnesota. So the Safe and Supportive Schools Act and the Minnesota Human Rights Act both contain anti-bullying provisions and can assist the students once they've had trouble. The Safe and Supportive Schools Act also includes model anti-bullying policies from the Minnesota Department of Education, and the more emphasis and focus that can be placed on that would be helpful. But schools and state agencies are going to need additional resources to implement and enforce anti-bullying because enforcement at the federal level is going away. We are going to need to make up for absent federal enforcement of civil rights laws. The Department of Justice and the Office for Civil Rights and the Department of Education are pulling back from enforcement efforts and cutting staffing. And in addition, the executive orders essentially direct them to use the resources that would typically go to enforcing civil rights laws to instead target and bully transgender students and students of color and immigrant students. We need clear direction to schools from the state legislature and executive branch to counteract those efforts. Thank you, and I'll wait here if there are questions after we've all testified. Thank you, Chair.
And thank you for waiting. And the last testifier, Natalia Benjamin.
Good afternoon. Can you hear me okay?
Perfect.
Thank you. Dear Chair Zadinsky and Senate Education Policy Committee members, my name is Natalia Benjamin, and I currently work as the Director of Multilingual Learning for Rochester Public Schools, and I am the 2021 Minnesota Teacher of the Year. I'm a foreign-born immigrant and a committed educator. Immigrants and children of immigrants should be acknowledged and treated with dignity, not only because they're an economic force to the United States, bringing $579 billion as reported in the 2022 data, not only because they farm our land, they harvest our crops, take care of the elderly in health facilities, they are teachers, doctors, electricians, home builders, and entrepreneurs, but because they have the same human rights as you and me. And like many immigrants who work hard and long hours, we deserve to be seen because of our humanity. And our children deserve to be seen because of their humanity. And this humanity and how we treat and discuss our students' needs is essential for success in schools. It is absolutely necessary for each and every student. The United Nations International Children's Emergency Fund, also known as UNICEF, recognizes los derechos del niño y de la niña, the rights for children, among which the following are listed: the right to equality and no discrimination based on race, religion, or nationality, gender, language, socioeconomic status, or any other condition, whether it is personal or that of their family. The right to an education and special education to those with any disabilities, the right to a free education, as well as the right to play and enjoy life, the right to assistance and help in case of danger, and the right to a free education that fosters solidarity, friendship, and justice around the world, to just name a few. Our own laws in the United States support this as well. Title VI ensures that students are not discriminated on any basis, which includes race, color, or national origin, and that they not be denied participation in education. Pryor versus Doe prohibits states from denying a free education to undocumented immigrant children, regardless of their immigrant status. And there's other legal requirements to speak of the need to provide language access to students and families. These are stated in Lau versus Nichols, Castañeda versus Pickard, the Equal Education Opportunities Act of 1974, Executive Order 13155 from 2000, Title III, and the Equal Student Success Act of 2015. Our school district is committed to following these legal requirements and will continue to do so as educational policy continues to evolve. But it is important to note that when our children experience fear of forced family separation, fear in the same of immigration policies, stigmatization, and different treatment, their education rights and legal precedents are being violated. Immigration processes are complex and layered. We have families who were in the midst of processing documents who may now be in limbo or who all of a sudden have lost their protected status. And they find themselves without answers and real fear of not knowing their future. I don't know what to do. Do I wait? Do I need to file additional paperwork? What are my options? Will it affect my children? Where can I find legal counsel? How much will that cost me? And while schools do not provide such counsel, they face the reality of this uncertainty for our families. Absenteeism has increased. Students of Latin American heritage are being bullied, called names, and dehumanized, regardless of their family's legal status. I will call ICE on you. Go back to your country. You don't deserve to be here. And yet, the large majority of our Latin American students in our schools are US born and are still antagonized. Parents are rushing to and from school because they don't feel safe. Many families who have legal status experience racial profiling regardless of their legal status. All of this because of anti-immigrant sentiments and rhetoric rooted in racial discrimination. While schools are required to address any of these illegal behaviors, such as bullying and discrimination, educational policies need to be explicit on what schools need to do to protect children and youth from these abhorrent behaviors. Education policy must protect our children so that they have access to a high-quality education that meets their needs. As you can imagine, learning in schools is hard when there is fear instilled because of these latest issues. Curriculum and instruction that may not be addressing all these pieces. So educators play a crucial role in supporting students so that they can be successful in school. This includes being responsive to their needs and creating a welcoming and safe environment for our students. This refers to a physical, emotional, and psychological safety. And to do this, educators, teachers, education support paraprofessionals, and other school staff should know the legal requirements regarding the students' right and ensure that they can articulate them and advocate for them. This is not only including their civil rights, but also the Family Education Rights and Privacy Act, or FERPA, which protects students' education records and gives parents and students certain rights. Educators should also be able to provide information and resources to families and students so that they understand their rights when it comes to access to a free public education, free of discrimination and fear. Districts should have policies and procedures that ensure our students and parents feel safe. The Minnesota legislature has made great strides in ensuring that students' experiences yield academic success. Some examples include the LEAPS Act, which positions multilingualism as an asset and provides a roadmap for districts to support the literacy development of bilingual and multilingual peoples. However, current funding sources do not provide enough support for districts to implement everything that's outlined in the LEAPS Act. The Indigenous Education for All requires districts to have materials and professional development that integrate Anishinaabe and Dakota culture, history, and contemporary contributions into Minnesota K-12 curriculum. It is crucial that this work continues until we can see full implementation with integrity. The Ethnic Studies Bill and the updated ELA and social studies standards ensures that our students access learning that makes their communities better by learning from honest history and literature. And current statute requires that instructional frameworks embed culturally responsive methodologies by school year 2025-2026. And there is ample research to support that this benefits every one of our students. So I am here to ask that we center the well-being of all students, particularly of those who are underserved and attend schools that may be underfunded. I ask that you support the work of previous years that advances learning for every student. And while Minnesota has some of the best schools in the nation, it also has some of the biggest inequalities in student achievement. So when we say that we care about all of our students, let's remember to include every student, especially those who are marginalized due to their minoritized identities. Because as Paul Weston said, when we all do better, we all do better. Thank you.
Thank you. Ms. Benjamin, congratulations on being Teacher of the Year. I don't know if you're still on there, but anyways, I know how much work that entails, and so congratulations on that honor being bestowed upon you. Members, any questions for the last three testifiers or overall comments on today's hearing? Who are we? I'm sorry. I know I'm kidding this time. Senator Mayquit.
Vice Chair Mayquit, if you want to get spicy. Ms. Benjamin, I want to thank you for testifying and what you're sharing, and what Sydney shared earlier as well is what my district has been sharing with me. And so as a lawmaker who can't change laws, federal laws, I'm wondering what would be helpful. Maybe it's from MDE, maybe it's from the legislature, for our multilingual and English language learner students, particularly those who are of Hispanic descent, because the fear that your students are experiencing in Rochester is the same that they're experiencing in Apple Valley, Rosemount, and Eagan. And I feel a little bit at a loss on how to help.
That might have been a rhetorical question if you're not, no, but I don't see, I meant because she can't reply.
Do you want me to respond to this?
Yes, please. If you, thank you for staying on.
Of course, you're welcome. And I think it's a reminder to know that we have these laws in place and protections for our students, that they shouldn't be facing any discrimination just because of how they look. There's a lot of assumptions on people's legal status. And so I think a strong message for our districts to share with our families as well, that we are committed to make sure that their civil rights are in place and that we will protect them from people that are just not willing to respect those. And I think that would be a strong message for everybody to hear.
Thank you. Senator Abler?
Well, thanks, and I'm happy to be naive and willing to learn. I just, apparently people talk to Senator Make-Wade from her district more than they talk to me. I believe we're equally intolerant about people discriminating against anybody for how they look or any reason whatsoever. And I know that our district has taken a lot of strides about that. But I don't know how many people are. This is probably the highest watched committee, Mr. Chair, of any committee. So all the people at home that are watching.
That's because they want to see you.
No, they know who's the chair and the vice chair in particular. But I don't know if, I mean, I knocked on every door in my district. And not bragging, but it was like a lot of doors. But so it didn't come up once. And so if people were frightened to tell me or something, please tell me, because as a committee, we are not willing to accept that as any state of affairs. And I think some people are uncomfortable doing that, but I want to know. And if you know, I mean, all of us here, I think we would want to know. And I think we would be the first ones to go to our district and go like, what are you doing? And what are you allowing? And so that's just my thought there. And so, you know, sometimes they think we wear a tie in the Senate. We look like, but we're approachable. We're just regular people. I go to the store. We hang around town. We go to a restaurant. So I'm just, do you go to a restaurant? So we all do that. We just live in our districts. And so I want to know, and I'm sorry for those people who have been treated poorly. It makes me sad. Anyway, that's all I got. Thank you.
Senator Duckworth?
Thank you, Mr. Chair. And just briefly, and kind of piggybacking off of Senator Make-Wade's suggestion would be, I think when we talked about school safety in this committee, it must have been last week, a question was kind of asked of the sheriff who was here, and his response basically was that he wasn't aware of that occurring, at least in schools. And so it might be helpful to have, what was it, Wright County? Thank you. It might be helpful to have either some law enforcement organizations or somebody that can kind of speak to it specific to schools, what they're seeing, so that if people have unease or anxiety about it, they can hear from folks that work in that profession as to what they're experiencing, what they're observing here in the state of Minnesota. And good for districts probably to hear too, so they can be armed with that information and try to fill that gap between families and headlines and figure out what the actual situation is, and at the end of the day let them know, hopefully, if it's the case, that kids should be in school, and depending upon what they have to say, whether it is an issue or not, they can make informed decisions based on that, and not maybe some of the other narratives that are out there that do cause them to have some unease.
And Senator Duckworth, if you can find that person that you'd like to have testify, I'd appreciate you taking that on, and I'd welcome the testimony. Senator Make-Wade.
Thank you, Mr. Chair. And Senator Duckworth, I genuinely want to share this with you, just from where it's bubbled up, and you know, we share a border, and so I hear from folks in your district too, as well as I'm sure vice versa. The fears are multi-pronged. Yes, there's the bullying and harassment based on looks or like first language or parents, regardless of status, but some real concerns around the rescinding of like not arresting or taking people from sensitive places. So I attend a church, Grace Lutheran. You know, we have immigrants that go to our church. That used to be a place where ICE couldn't come and take people. School was another one of those places, and so that's what I'm hearing from a lot of the students is they're scared to go somewhere from their home where people are allowed to come in and potentially take them, and or to go home and realize that their parents are gone. And so that is a huge fear. And then there's a secondary one, and this I hear more from parents than from students, but the data breach at the U.S. Department of Education, not being so clear on what information does the U.S. government have on me and my family and where my kids go to school, and how are they, zooming in on a significant population of X or Y or Z in a school district. And so that's where the fear comes in. And then there's stories that have certainly been passed around the community that are real of, a family from Puerto Rico is a mom and her toddler and her grandma, which, Puerto Ricans are American citizens, were arrested and detained because they were speaking Spanish in a mall. Like, those kinds of things are what permeates down into students and the general attitude. And so that's where, and there's more, but those are the things that are coming up, and ELL services being used as a way to zoom in on specific kids for whatever. That's where that comes from.
Looking for solutions.
We all are.
This is a productive discussion, and I think given the controversy and the challenges, I think here you have people from all across literally the map to trying to sort this out. Just what I wanted to bring up, and dragging this out 30 seconds longer, is that I think we need to be careful of the things that we do pass that actually have that are counterproductive in accomplishing that. We put a ton of money into schools, but we tied it all up in lock boxes, and the districts have a hard time reacting to their local needs. We can actually improve upon that. We changed the licensure ways for people of color to get a license. We made it much more difficult by locking the door on the one that was the most productive on this tier 2, 3, 4 business. And I think that we're seeing some of the effects of that, both on attendance and on some of the issues that come up in schools. So I just think some of that stuff, by thinking that we're helping, we may be harming. So I just think we need to be careful through the lens of everything we do. Have we made it better or worse for all the topics we've covered today and this week? So thank you, Mr. Chair and Madam Vice Chair.
Well, that's it. Thank you for members and members of the audience and members of the committee for all your insights and observations today. Appreciate you all being here today to listen. And our next meeting will be Monday, February 17th, where we will be hearing bills. And hopefully we'll have a couple of speakers that were asked to come in, and we'll see if they're available. And so, okay, we're adjourned.